Namaskar. Today we'll study thiazolidinediones, which are anti-diabetic drugs and act as insulin sensitizers, and they are used in case of insulin resistance. Examples are rosiglitazone, pioglitazone, troglitazone, siglitazone, n-glitazone, and they act as agonist on the receptor PPAR-gamma, which is a type of nuclear receptor and is present as a dimer with retinoic acid receptor in the nucleus. So when thiazolidinediones bind to this receptor PPAR-gamma, which is present in the nucleus of adipocytes, skeletal muscle and liver cells of adipose tissue, skeletal muscle and liver inside the nucleus, PPAR-gamma receptor is there. Thiazolidinediones bind to these receptors, and that complex now binds to the response elements present in the gene or DNA called thiazolidinedione response element or PPAR response element, which causes the gene transcription. So because of gene transcription, there will be conversion of DNA to mRNA, and then mRNA to proteins will be there, and those specific proteins can do cellular functions. Let us see how the thiazolidinediones act. Thiazolidinediones bind to the PPAR-gamma receptor. That complex will bind to the PPAR response elements in the DNA, and that will cause adipose cell differentiation. That pre-adipocytes will be converted to adipocytes, which will secrete adiponectin. Adiponectin has two functions. One, it increases the expression of PPAR-gamma angiopoietin related genes, and second is it activates AMPK, AMP activated protein kinase, and by the increased expression of PGAR, there will be angiogenesis, formation of new blood vessels in adipose tissue, so that will cause adipose tissue development, and that will stimulate fatty acid storage as triglycerides and decrease the free fatty acid secretion from the triglycerides. So this will be facilitated and this will be inhibited. And second thing, by activating AMPK, AMPK will phosphorylate ACC, acetyl coenzyme carboxylase, which is a key enzyme in the fatty acid synthesis and fatty acid beta oxidation. So it will inhibit, by inhibiting ACC1 and ACC2, there will be inhibition of fatty acid synthesis in liver and adipose tissue, and promote fatty acid oxidation in skeletal muscle and liver. So all these actions will decrease free fatty acid in the blood, and free fatty acid actually competes with glucose for uptake into the hepatocytes and skeletal muscle. So when there will be decrease in free fatty acid by thiazolidinediones, so there is less free fatty acid to compete with glucose, so that will increase the glucose uptake, and decrease in free fatty acid in blood will increase the GLUT4 expression, and there is increase in glucose uptake, and that increases the insulin sensitivity. So in case of insulin resistance, we can use thiazolidinediones as an insulin sensitizer. So we can use them in type 2 diabetes mellitus with insulin resistance, where high doses of insulin do not show their action, and they have side effects like hepatotoxicity. There is risk of myocardial infarction, congestive heart failure, there is cardiotoxicity, and because of the cardiotoxicity, just recently rosiglitazone is banned. The thiazolidinedione rosiglitazone is banned, and there is also increased hepatotoxicity by these drugs, and they also cause weight gain because of fluid retention and edema. So these drugs are contraindicated in hepatic failure, congestive heart failure, obesity, and in pregnant women, in lactating or nursing mothers, and in children. So they are contraindicated. This is all about thiazolidinediones. Thank you.